Welcome to God's Own Hands. പഞ്ചേന്ദ്രിയങ്ങളിൽ പ്രധാനപ്പെട്ട അവയവമാണല്ലോ കണ്ണ്. മനോഹരമായ കാഴ്ചകൾ കാണാനും ആസ്വദിക്കാനും സാധിക്കുന്നത് കണ്ണുകളിലൂടെയാണ്. കണ്ണുകളുടെ ആരോഗ്യം നിലനിർത്താനും ആരോഗ്യ പ്രശ്നങ്ങൾക്കുള്ള ചികിത്സയും പറ്റി ഗോഡ്സ് ഓൺ ഹാൻഡ്സിൽ നിന്ന് നമ്മോട് സംസാരിക്കുന്നത് കരാമ അപ്പോളോ ക്ലിനിക്കിലെ ഓഫ്താൽമോളജിസ്റ്റായ ഡോക്ടർ ശ്രീലേഖ പലംപർത്തിയാണ്. ഡോക്ടറിൻ്റെ ചികിത്സാ അനുഭവങ്ങളിലൂടെ നമുക്ക് സഞ്ചരിക്കാം. Welcome, Doctor. While talking about your professional and academic life, can you tell me about your academic life? How you came to this medical field and how you become a clinician?
For me, the first inspiration is my family doctor, Dr. Venkat Reddy. Unfortunately, he's no more, but I like the way everyone looked up to him, everyone respected him, and he treated everyone with equally, with care, compassion, and so much patience he used to have. So I wanted to become someone like that. So that inspired me to become a doctor. So I did work hard and then went into one of the top colleges in my state, which is Osmania Medical College, and then I decided to be an ophthalmologist because I was fascinated by the fact that eye, being one of the smallest organ in the body, it controls most of our day-to-day actions, our day-to-day activities. So I wanted to study about it more. And there's a saying in Telugu, Sarvendriyanam Netram Pradhanam, which means sight is the most important among all the senses. So I wanted to use my knowledge and help people preserve that sight and make it better.
Doctor, while doing your PG, you have told you have microspecialty in glaucoma. So what was an inspiration for taking glaucoma as a fellowship?
I had professors with different multi-specialty in JIPMER. I was fortunate to work under every one of them. I was more fascinated with the way Dr. Subhashini treated glaucoma patients, and she specialized in glaucoma. And I wanted to, I was, I fell in love with the subject, so that I wanted to do that more. So that is the reason for me taking fellowship in glaucoma in Arvind, Madurai. And the teachers there are so amazing, and they taught me everything that I know. So they were calm, they were patient, and everything is about scientific knowledge with them. So I was fortunate to have such amazing teachers in my life.
What was your first professionally? What was your first job?
Uh, as a ophthalmologist, we usually deal with all kinds of cases. Being my interest being in glaucoma, I still deal with all the cases because of my ophthalmology degree, of course. So my first job was in Hyderabad, where I specialized in, like, I saw most of the glaucoma cases, but at the same time I saw all kinds of cases. Because of the basic knowledge that I had, luckily, I was able to deal with different complicated cases, at the same time normal cases which we get in a day-to-day basis. So that was, even though my interest in glaucoma, I love seeing all the types of cases.
So you have practiced in India as well as in UAE now. And what is the difference you felt during these clinical practices?
Uh, it's always different in when you practice in a different country. In India, I was always in the tertiary setup where we see, where we are always with colleagues, and it is a group thing. Here, my first job here is me working in a medical center, and it was me individually. It's like sitting. I have to make all the decisions by myself, which I usually do in India also. But this was like a total different experience. It was challenging, but at the same time, I was up to the challenge. And yes, the difference from India and here is that India, only few patients have insurance, and we had to deal, very few patients, dealing with insurance is very less there. Here, almost all patients have insurance. So it's almost the same. The way we follow the protocols, the way we write the case sheets, and everything are the same. Just that we need. Um, there are few things which are little bit we need to keep in mind, and we need to follow some particular things. But it was. But eventually I was able to acclimatize to it, and it became easy eventually. I had a support system of the staff and my colleagues in the field who helped me through all the hurdles. And whenever there are very kind doctors around me who are very experienced, who have immense experience in UAE, who helped me through the process. So that way I was able to easily acclimatize to the situation in UAE. Like I said, the treatment of patients and everything are the same. Just that the few protocol difference that happens in different countries, but I was eventually able to manage it.
So you are telling that UAE is more technologically developed, or the facilities are more available in UAE compared to other countries?
I don't completely agree with that statement. Coming from tertiary hospitals in India, where Arvind is like the largest eye care
Yeah,
system
yeah.
and Jikmar is like a tertiary care, it's a central government run institute. We have very well advanced technologies there. They update every time a new technology comes, it is always updated. The scientific research is also going more in the institutes that I've worked in India. Here also we have the same thing, but I'm not going to say it is more than that of India. So we do have good this thing in India and in the UAE.
Okay. So, when coming to UAE only, this insurance system, do you think it is helping the layman or ordinary people to get the advantages of all these technological developments?
Sure, it is helping people when the cost is always the factor. When you have an insurance, you are able to access everything. So you don't have to worry about how much you need to pay for this thing. You don't have to worry about the future. When you have uh, something backup, that you have an insurance, if you have some illness that needs treatment, you will get it treated. So that is an advantage that UAE has with the compulsory insurance system, that is making easy for even for the doctors to treat without thinking about the economical status of the patient. So that is actually an advantage here.
Can you just give us a brief about blindness and glaucoma?
Glaucoma is basically silent thief of vision. That is what we usually call it. There are some glaucomas which cause pain and discomfort, but majority of them are silent. They're only diagnosed in an advanced stage. Because usually it starts in the periphery. The blindness starts in the periphery. So you won't be looking at the periphery, like you will be looking at the straight. So when that happens, you won't realize that your field is getting constricted unless it got so much constricted that it is affecting your day-to-day activities. Unfortunately, by that time, majority of the damage has occurred. So, to prevent blindness due to glaucoma, we advise regular eye checkup at least after the age of 40. Or if you're below 40, if you have certain risk factors like family history of glaucoma, if you're on long-term steroids, or if you had a trauma, you always need to get regular checkup to see if we can diagnose the disease early. Early diagnosis and timely management can prevent blindness in glaucoma. So it is a very difficult thing when we see patients at a late stage, because always we have in the back of my mind that if only they came to us earlier. So I want everyone to know that glaucoma is a serious condition and regular checkup can prevent blindness in it.
Okay, so do you have, can you give an advice to our viewers for eye health? What all the things we have to follow and we have to do?
Eye health is important. The first thing, like I said, is regular eye checkup. The second thing, this day and age is the digital eye strain because of increased use of computers and even kids, like they don't go out. Optimal sunlight is exposure is important for kids also, and they usually get confined at home. I think because of the COVID situation and the home that online classes situation, but they need to get optimal sunlight exposure, and they need to decrease the the use of digital screens as less as possible. I understand that for study purpose they are still using it, but just try to limit them as much as possible.
Can you tell us about some unforgettable experiences in your career?
There are many unforgettable experience. I think the first unforgettable career case in the my glaucoma career is this. middle-aged man, he's in late 40s. He came with complaints of eye irritation and eye discomfort, nothing else. Just eye irritation and eye discomfort, which usually everyone has. On further examination, we found that his pressure is above 70. Normal pressure is 10 to 18. Imagine the patient has 70 pressure, which is like very high, and the patient was calm. Like that is when I got the real idea of how glaucoma is. And when we further investigated, I found that the patient had very constricted, narrow visual fields. And it was so narrow that usually patients present at a stage earlier than that. So I asked him, why did you come at this stage? You could have come before, when you realized that your vision is getting narrow. He said he thought it was cataract. So once we remove the cataract, he assumed that vision will come back. Unfortunately, glaucoma is very unforgiving, because once the damage sets in, till now there's no technology to reverse it back. The only thing I could do is prolong the blindness to set in for this patient. So that's why I advise regular checkup. Early diagnosis helps prevent this stage of glaucoma.
Okay. So that was an interesting case of glaucoma. And any emergency conditions or any critical cases you have come across?
We do deal with emergency cases. The most common one which we deal is acute angle closure, where it is a form of glaucoma which you present with sudden high eye pain, because suddenly eye pressure increases. You have redness, headache, or vomiting sensation. All these things will be there. And if this is a time sensitive diagnosis, because once we see that case, we should not leave the patient with high pressure for a long time. If we leave it for the long time, the nerve damage starts to set in. So before the nerve damage sets in, we have to intervene, we have to decrease the pressure. So I had got a case during the COVID time, and this was a time where the not much study was done on COVID. So our protocols were to limit the patient's exposure to the hospital or anything. And unfortunately, she is also asthmatic. So and she is having a little bit mental disabilities. So the cooperation was at question. So usually a normal situation with mental disabilities, we take up for surgery under anesthesia, even if it's acute angle closure, because giving a laser will be difficult. But we do try to give laser. In this case, my aim was not send her to surgery. Do the laser, try to make her as cooperative as possible. I remember the sayings told by one of my ortho professor. It's called vocal anesthesia. That means with our words only, with our explanation to the patient only, the anxiety is relieved more than a sedative. So her mother is very well informed. So me and her mother, and with the help of my sisters, we tried to relax the patient. And within 3 attempts, I was able to do the laser and relieve the pressure. And yes, we called the patient again for the other eye, which was not an emergency. And surprisingly, she cooperated well for that other eye. So I was happy that I prevented surgery in this patient, and I was able to manage a complicated case in that kind of situation. So that was kind of memorable to me.
Yeah, it is a really miraculous thing that that time you could manage it without a surgery, right? Yeah, very good. So in these conditions, do you think we are all tools of God and we are doing His wish through us?
Yes, we do need luck or the God's way that we say in these conditions, because anything can go wrong. If I had to say in this case, if she were, it's the procedure needs complete cooperation. They have to look straight, and then they have to be calm. Like if they're having pain, so many other reactions will happen. So we try our best to decrease the pain, but the anxiety will increase the sensitivity to the pain. So I was lucky during that time that the attender is well informed, the mother is well informed, and we were able to calm her down. It's not an easy thing to calm a person with mental disability, because they are in a new situation, and hospital is always scary. Even for a normal person, it is scary. And then we were able to do that. I feel it is the miracle and some God's grace I had that at that situation, especially during the COVID time. If it were a normal time, I would have assistance, but COVID time, less number of doctors, and I had God's grace during that time.
Okay. What is your future plans, like doing any PG or any other contribution to the field of ophthalmology?
Yes, I'm interested in research, so I have published few articles regarding that. So I want to continue learning more about my the glaucoma is not the end of the subject. There are more things I can learn in glaucoma. So not just glaucoma, the whole ophthalmology. Even though we feel that eye is a small organ, there is a lot of things, lot of developments going on. So I do want to continue the learning about it, and I do want to go into a research and help develop new techniques to treat certain things, or help develop few things that can help ease our way to investigations or ease the life of the patient.
Nowadays, most of the parents are complaining about kids having refractive error problems, but they are not able to express their problems to even teachers or to the doctors. So, how we can manage such cases, that refractive error cases in kids?
These days, myopia is increasing in these kids because of the increased use of the digital eye screen, the near when they put it near, and then there is a decreased amount of exposure to sunlight than we used to have during our age. So this causes increase in the incidence, increase in the number of kids having glasses. So yes, it is a problem these days because of the home confinement and the technological advances and everything. We can help the kids by diagnosing it early stage, and then if progression is there, we can there are still methods to intervene. So kids usually can't say that they can't see unless they are put in the class. The teachers are the first one who see, and sometimes when one eye is better and the other eye they are not able to see, they sometimes go on with it. So there are subtle signs like the deviation of eyes that the parents can notice, so that they can get an early treatment for all that. And regular checkup is, like I stressed on it, regular eye checkup is also important, especially in this generation where more use of digital eye, not just a refractive, even dryness, back pain, so many things happen by increase of digital screens. So regular checkup will help us diagnose refractive errors, and if it is like the progression is going too fast, like sometimes within a year -1 progression will be there. If all the in to prevent all that from happening, we can intervene early only, and we can try to decrease the progression in these kids. So regular checkup and decreased use of digital screens. So that will help.
Okay. Would you like to add some points for the glaucoma in kids?
There's a serious burden of congenital glaucoma in kids. Usually, in kids, if the pressure in the eye is increasing, the size of the eye increases. So, that would be the first sign. Usually, a parent notices that something is wrong with the kid. Managing congenital glaucoma is a little bit complicated. It can be either so easy that we can relieve the pressure, or it can take time and multiple procedures. The same early diagnosis, once you see a change in shape of the eye, or seeing a whiteness of the black eye, you can diagnose it early, diagnose the child early and help. Like, I can tell you a case where a child was had this large eyes. The parents thought it was a normal abnormality. She came at a late stage, like maybe after 2 years that this started happening. But still, we were able to intervene under the guidance of my professors. We were able to do the surgery and help the child. And the other thing which is and the other cases which usually we miss are the syndromic childs, where a child will be having different problems in the body, so they usually overlook the eye. I had a case who had a syndrome called Seckel syndrome, who had one eye glaucoma. Like, it was obviously the size of one eye is more than that, but unfortunately, because he has several systematic conditions, people overlooked it. So my advice would be, and the association of glaucoma to that syndrome is very rare. So, if even if any kind of syndrome, I advise everyone to get an eye checkup done. Like, there may be a rare presentation of glaucoma in such cases. Unfortunately, we are not able to save that eye in the child, but because we notice the glaucoma in that eye, we advise the parents to have regular checkup so that we can catch the glaucoma in the other eye. So we advise them regular follow up, so that at least we could help the other eye.
So, what you want to advise to parents who are not aware about this condition?
Usually syndromes are they're very apparent, and congenital glaucoma, Like I said, the first thing you will notice the increasing size of the eyeball. The black part of the eye will become white. So these signs should prompt them to get a immediate eye checkup. So
So changes like this to be noted, and they have to be treated properly so that they should not harm the vision of that child.
yes, there should not be a permanent damage to the child. If we intervene at an early stage, that also God's grace is there, because every child reacts differently to different kinds of surgery. So we can try, if the child reacts positively, we can save the vision of the child and they can have a long, healthy life with good vision.
So for this glaucoma, a thoroughly correct checkup and medication, with this medication, we can prevent further worsening of the condition, right?
Yeah, see, glaucoma is a progressive disease. What we can do is slow down the progression and prevent blindness. If we don't give treatment for this disease, the progression will be very fast. So that is why timely diagnosis and management can prevent blindness in these cases.
While coming to lifestyle diseases, many of the lifestyle diseases having direct connection with the eye problems. So, what are all the cases you are getting, the eye cases related to lifestyle diseases, and what the advice you want to give to the
The
viewers?
most important lifestyle diseases which is related to eye is the diabetic retinopathy. This is also a silent disease, especially in the early cases. That's why when you are diabetic, it's better to get a regular eye checkup done so that we can diagnose a case diagnose you at a stage where we can intervene to prevent any damage from happening in the future. Also, diabetes presents in different ways. Like I had a 30-year-old male who presented with hemifield, like half of his vision is gone.
Okay.
Like he didn't have any systemic condition. So we diagnosed with a nerve condition. And that nerve condition is seen in many systemic diseases, one of them being diabetes. So that is how we diagnose diabetes in that patient. Like being 30, we usually don't get checkup. But the only presentation that patient had was the hemifield loss. So it presents in different ways in the eyes. The most common one is the diabetic retinopathy. So like I said, if you are diabetic, if you get regular checkup, we can catch it early and can help prevent permanent blindness in these cases. The other one is hypertension. Eye is a place where you can see the vessels directly. So we can, it usually correlates with the systemic disease. So if you're newly diagnosed with hypertension, you can get a eye checkup done to at least know what stage of hypertensive retinopathy you have, so that we can approximately predict the systemic involvement of the systemic complications that occur due to the hypertension.
Doctor, can you advise our viewers how to protect our eyes in the climatic conditions of UAE?
The most common thing that we face in UAE is the temperature, right? Yes, wearing sunglass, especially the one with complete like 99 to 100% UVA and UVB protection, and which a full cover, not just the small ones. Good eye cover sunglasses will protect you from the sunlight and the diseases related to the sunlight. And there's other thing which is most common is the dry eyes. So yes, good protection will prevent that, and at the same time, getting a regular checkup to see if the dryness is not too severe, where we can intervene with eye drops or something, also can help in these conditions.
So more, why this eye dryness is coming, because of the climate or any other?
Sometimes yes, because of the climate, and sometimes because of long-term exposure to the AC. Because UAE is a place where so much AC is there. So when you have direct contact, direct this thing with the AC, the evaporation happens. And then also when you sit in front of computer for a long time, when you look at it with so much concentration also, no, enough blinking won't be there. Blinking helps to replenish the water, so that also can cause dryness. So there are several reasons, especially in the modern way of living, that dryness is pretty common. But there are so many ways to intervene in this. We can start with eye drops, and then there are so many technological developments also to help with the dryness in the patient.
How to prevent that dryness?
If you are in the working in front of computer, there are three things that I usually tell my patient. The first thing is 20-20-20 rule. So take a 20-second break every 20 minutes and look at something at 20 feet.
Okay.
And the second thing is you have to remember to blink. At least try to keep an alarm or something and remember to blink. And there's a study done where they found that that refresh, right click refresh. So that increasing the refresh rates will decrease the eye strain. The defocus supposed to cause the eye strain. So when you increase the number of times you do refresh, the eye strain will decrease. And also the use of lubricants will help them use the system.
Can you give us some details about the eye cancer awareness?
Yes, eye cancers are very rare actually. I'll tell you about the most common cancer inside the eye in the kids, which is retinoblastoma. Early diagnosis can save the sight and life of the child. The most common sign that we see in retinoblastoma is something called white pupil. Normally, when we take a flashlight photography or in a dim light, we see a red reflex. But in these kids, you see something called white reflex. This white reflex is seen in other conditions like cataract and retinal detachment, which also need immediate intervention. But this will be the most common early sign of the disease. So if you see kids having this white pupil instead of red pupil, you need to get an early intervention done. The other one in adults, the most common cancer inside the eye is something called melanoma, choroidal melanoma, uveal melanoma. In this, you can basically most common risk factor is the sunlight exposure. So by wearing protective sunglasses, you can at some rate prevent the disease from happening. Also, regular checkups can help diagnose the case at an early stage. So after 40 years, I advise everyone to get a regular eye checkup done.
Okay. Thank you, doctor, for giving your valuable time to us and sharing us your knowledge. കണ്ണിൻ്റെ ആരോഗ്യത്തിനും കണ്ണിൻ്റെ ആരോഗ്യ പ്രശ്നങ്ങൾക്കുള്ള പരിഹാരങ്ങളും ഡോക്ടർ ശ്രീലേഖ നമുക്ക് പറഞ്ഞു തന്നു കഴിഞ്ഞു. ഡോക്ടറിൻ്റെ എക്സ്പീരിയൻസസ് വളരെ ഇൻഫോർമേറ്റീവ് ആയിരുന്നു. അതുപോലെ തന്നെ ഡോക്ടറിൻ്റെ എക്സ്പീരിയൻസിലൂടെ ഒരുപാട് പേർക്ക് മെസ്സേജസും കിട്ടിയിട്ടുണ്ടാവുമെന്ന് കരുതുന്നു. താങ്ക് യു സോ മച്ച് ഡോക്ടർ. ഇന്നത്തെ ഗോഡ്സ് ഓൺ ഹാൻഡ്സിൻ്റെ എപ്പിസോഡ് ഇവിടെ പൂർണ്ണമാകുന്നു. അടുത്ത ആഴ്ച വീണ്ടും കാണാം. ബൈ.